Well, the American Academy of Dermatology is targeting one group in particular. This new PSA is trying to get the attention of that group. The Academy says men over 50 years old are at a higher risk for developing melanoma than the general population.
Most guys aren't thinking about that, and particularly older guys like myself who love being in the sun and never wore hats and never wore sunscreen.
Now, the 5-year survival rate for those whose melanoma is detected and treated before it spreads is 98%. Experts say you should tell your dermatologist if you notice any suspicious moles. They may indicate cancer. Joining me now is skin care specialist Dr. Robert West to talk about the dangers of prolonged sun exposure and also the potential signs of skin cancer.
Hi, everybody.
Hi, Dr. West.
So as most of us know, the sun's rays, there's UVA and UVB, and both affect us in different ways. UVA is a little more penetrating, causes aging, damages the dermis, gives us aged skin. We got some photos here of patients with a dermatoscope, so that's without a dermatoscope, so some of the stuff that I do. This showing some subtle changes on the left is a year ago, on the right is a follow-up, and so you can see on the gross exam not much change, you wouldn't cut that out, but here on the right we have what we call dysplastic cells, so they're not quite even melanoma yet, but we get that out. Excellent cure rates with that.
Well, we know that sun exposure is cumulative. The damage might not appear right away. What are we looking at? You know, those moles right there, that's over.
Here's another subtle lesion on somebody's toe. So when we do skin exams, we have them dressed down. And I will look pretty much everywhere except under the bikini line, so it's a little more comfortable. And on the right, we can see undulations that we have on our palms and our feet. And the pigmentation there in the center of what we call a ridge tells that this mole is not something we want to leave on, so we'll cut that off.
Okay, so for people at home right now, they love the sun, you know, what should they look out for just to be safe?
So the ABCDE criteria, asymmetry, border, color, diameter, and evolution is something we go through at the visits at Arrowhead Health. So a patient comes in, they get undressed, and as I'm doing the exam, I'm running through these things. So things that are perfectly round are symmetrical and are better than things that are oblong and not.
Right. And, you know, it doesn't even matter if you are just laying out of the pool or maybe you step out of your car for a second. I mean, everyone needs protection.
Correct. So there's sort of the everyday sun exposure. If you're an office person, you're going from car to office and back and forth. Makeup for women is a big deal, having SPF protection in there now. People like my PE teachers and letter carriers that have chronic sun exposure, they have a higher risk of squamous cell carcinoma, and again, it is cumulative over time. Sun protective clothing is probably the
hats,
the best thing, right now. So I brought props if you want to see props.
Really? Let's see your hats.
So different kind of props here. So something that's light, and obviously.
Oh, I have one of these in my car.
For that.
I feel like this gives you like ultimate protection.
If you're out on the sailboat and you're going to get a lot of water, something's got a little more sturdy rim.
Yeah.
And then for the kiddos, of course, the sun protection shirts are getting much more comfortable and fashionably acceptable. So for boys, for girls, this kind of stuff. And here you have to be a little bit careful. If you put sunscreen on, put this on, and then take this off later. It will rub the sunscreen off, so reapplication, we've heard that before.
Right. What SPF should you have? What number?
So there's been a large debate about, you know, should I go over 50 or not? And we've not seen any deleterious effects with the higher you go. So as far as I'm concerned, the highest you can go, the better. And some people may not tolerate with their skin an SPF of 100, so if you put something on and it bothers your skin, obviously switch brands, get a lower SPF. But I'm trying to get people 50 and up.
50. Wow, 58 or up. Okay, that's really good to know. It's going to get hot out here. The sun's going to come up. Stay protected.